Hello and welcome to a new episode of Aston Originals Health Matters. This time we are looking at eye health, as this week it is National Eye Health Week. The theme for 2024 is the importance of good eye health and the need for regular eye tests for all. As I hope you're aware, Aston University has a thriving optometry school, and I'm joined today by Professor Leon Davies, interim head of the school and immediate past president of the College of Optometrists. He is ideally placed to talk about the importance of good eye health. So welcome, Leon.
Thank you very much, Helen. Great to be with you.
Yeah, good to have you. Could you tell us a bit about you and your background and some of your research interests?
Okay, so with respect to Aston University, I first came to Aston 27 years ago, pretty much this week, as a shiny new undergraduate student. Following my undergraduate degree, I spent some time in clinical practice, as all optometrists do, at Boots Opticians and also Wolverhampton Eye Infirmary. I then swiftly returned back to Aston to commence a PhD, which I completed, and then started as a member of academic staff. That will be 20 years ago in January next year, and then have worked my way through the ranks, as it were. I've had two terms as head of school, one between 2016 and 21, and this year I'm back in the role supporting my colleague who's on a year-long sabbatical, circumnavigating the globe. So outside of Aston, I have held a number of roles, as you mentioned, most recently as president of the College of Optometrists. That ended in April of this year. And following that, I took on the role as chair of the board of trustees, which I commenced again in April. And research is a key part of what I do here at Aston, and that goes to inform everything that we do, really, as educators and training the next generation of optometrists. So I'm really passionate about that as well.
Great. So Aston School of Optometry, as I've already mentioned, is quite busy, quite big. Could you tell us a bit about the history and the background of Aston School of Optometry?
Yeah, so it's quite interesting, actually. I've just been writing with colleagues a paper looking at the history of UK optometry and where we're heading, because we're in a position at the moment where our regulator, the General Optical Council, has changed the rules of engagement for education, and we're working to a new programme, which is a level 7 integrated masters. So as part of that work, I've been looking back to try and find the genesis. When did optometry, or in those days, ophthalmic optics, when did that start? And I think I've now pinpointed that down to nearly 100 years ago. So in 2026, in some form, optometry or ophthalmic optics will have been at Aston University for 100 years. So that's quite exciting that we'll be able to celebrate our centenary in a couple of years' time.
It's a decent amount of time to keep going.
Thankfully, I've not been here for all that time.
So how big is the school? How many students? How many staff?
Yeah, it's a good question. Again, I'm trying to find whether I can categorically say we are the largest in Europe or indeed the world. I think it depends on how we sort of capture that. Certainly, with respect to our undergraduate cohort, in the UK, we are the largest. We have more students per year than any other course. And I think that's the same both in Europe and around the globe. Obviously, some programs have more years, and that means their total headcount might be a little bit more than ours. So we've got a large undergraduate program. And in terms of our staffing, again, we have over 20 sort of staff on campus who support our undergraduates and our postgraduates. But we also have in the order of about 50 visiting members of staff. So these are individuals, clinicians, who work in high street practice or they work in hospital settings, and they're so valuable. They come in and they help to teach our third year students predominantly, but also some second and first year taught practicals, and they bring that experience on campus. So both the on-campus staff and our visiting staff are essential to delivering our education.
Great. So this is, of course, National Eye Health Week. So what why are regular eye tests so important?
Yeah, it's a really good question. Most people will know that you go to your optometrist at your local opticians, and they will be able to prescribe spectacles or help you with a contact lens fit that you could then wear for sports or other recreational reasons. But having an eye examination, a sight test, is so much more than that. So we, as optometrists, are primary care clinicians. We're able to support patients who come in either with symptoms or without symptoms. So just going for your regular screening, and that will depend on your sort of characteristics, whether that's 1 year or 2 years or less than 1 year, in fact. We're able to pick up with the techniques that we have. We can look into your eye, we can look at the back of your eye, and arguably it's the only place in the body that we can see blood vessels without actually cutting open the body. So things as simple as and as common as high blood pressure we can detect, diabetes, and other systemic diseases that can be picked up when you have absolutely no symptoms at all. We can either manage those in practice. So if it were some dry eye problems that you maybe have, or it was even conditions such as glaucoma, which is where you have often high pressure inside of the eye, many optometrists now are trained to independently prescribe. So they may be able to treat those conditions there and then, or work as part of a multidisciplinary team with, let's say, an ophthalmologist in a hospital to be able to treat those patients closer to home. So we always say it's much, much more than just spectacles and contact lenses. We're able to detect problems with the eye, but we're also able to detect problems with general health as well. So it's an all-round health screening.
Oh, it's good to know. I mean, the glaucoma thing I'm kind of aware of because I have a family history of that. So I'm fine at the moment, and long may that continue. But that is something that I'm being checked for when I get my sight test done. But you mentioned there's sort of a general health screening as well. What else can you pick up?
All sorts of conditions, from problems with the digestive system, which can be seen in different ways, in which the back of the eye changes, and even conditions that can cause changes to the cornea, which is the transparent part of the front of the eye, or the lens inside the eye as well. There are conditions associated, let's say, with the thyroid. So we might find that the eyes have a different position. So they may be proptosed. That means they sort of stick out a little bit more. Or it could be that a patient's been on long-term medication, and that the medication again may have a side effect that can be seen in the eye, and that might mean that we work with a general practice or we work with the hospital and we say, well, actually, we've seen these signs now. Do you still want that patient on those medications, or actually should we be changing those? So again, it's not just about detecting the diseases; it's the interventions there as well, which may have a secondary effect in the eye and elsewhere in the body that we're able to pick up and then work, as I say, as part of that multidisciplinary team to ultimately support the patient.
Really good. Now, the School of Optometry at Aston has lots of eye clinics. Can you tell us a bit about those and all the facilities? Because there are a lot.
Yeah, we're really proud of the facilities that we have, and we've had them decades now. We moved into our existing building in 1986, I think it opened, and the now King Charles III opened the building. So we've got a nice photo in the reception area when he was with us. So we've got in the order of just shy of 30 clinics. So again, we're probably one of the largest opticians, as it were, in the UK.
Right.
And during term time, undergraduate students will work in those clinics. And again, as I said earlier, we have some of those visiting clinicians who will supervise the students, and real patients come in. And we've
Like
got
me.
some patients, sorry?
Like me.
Yeah, absolutely. So staff on campus or the local community. And in fact, we have had patients come as far as Wales and Cornwall, and up north of England for some of our specialist clinics in particular, some of the paediatric clinics where there are very few optometrists in the UK that really specialise in some elements of optometry. So we're able to support people as far-flung as I say, Wales and Scotland and elsewhere. So that's a really thriving clinic, and it's so important not only for the patients who come in, but also for the students, so that they have an opportunity in a safe environment with time to develop their skills, and then when they eventually are qualified, then they can go out there into whatever mode of practice, confident that they have the skill set to do that.
Yeah, because they've met real people, It's definitely
Absolutely.
helps with real things to potentially pick up on.
Yeah.
Me, it's just that I'm getting more short-sighted.
Ah.
So I know there's some sort of specialist clinics at Aston University as well. So what kind of specialist clinics do you run?
Yeah, well, you've just mentioned, Helen, about being short-sighted, and this isn't something new. So being myopic, where in effect your eye is a bit too big for the optics of your eye, means that you need spectacles to help see in the distance. But in recent years, as well as the research that we do at Aston, the clinic that we have for myopia, there's a lot of work now to um, work with patients, for clinicians to work with patients to prevent myopia occurring in the first place. And this can be anything from advising parents um, to make sure that their children are playing outside more, because that's been shown to have a protective effect. Obviously, by doing so, you're also not looking at modern devices like computer games and those sorts of things. But also we have spectacles and contact lenses now available in the UK, which prevent myopia from occurring or slow down its progression. And so we have both the research clinic, but also an eye clinic for myopia specifically, where again we can refer patients into, and we can track them using a whole range of equipment that we have, looking at the length of the eye and the prescription, to make sure that we're minimizing the myopia. And the reason that that's so important is it's not just about being able to see in the distance. It is associated, myopia that is, with conditions later on in life, such as macular degeneration. So the chance of you getting a condition such as macular degeneration increases the more myopia that you have. So it's not just about helping these kids see well so that they do well at school, for example, but
Yeah.
also when they're in their 40s, 50s, 60s, we're trying to prevent other diseases occurring within the eye, which of course will have a negative impact on their quality of life later on.
So that's something I didn't know until, well, today, in fact. This is something you can prevent and, stop it happening rather than just prescribing thicker and thicker lenses. So, that is quite, and I think as well, the other thing that I learned recently was about just being outside and how much that helps, because I didn't know that.
Yeah.
I found that out from the inaugural lecture from Nicola Logan, who's another professor at Aston University, and her research into that. So I had no idea. So I now go outside a lot more. So,
Indeed. And it's not just about the vitamin D for your general health, but definitely for your eye health as well. And this week, you mentioned Nicola, along with a number of our colleagues and some researchers from my lab, are at the International Myopia Conference, which happens every other year, and that's in China at the moment. And it's important that it's in China because we know the prevalence of myopia is much, much greater. It's a global problem. But in places such as Hong Kong, China, Singapore, up to 80% or more of the population are myopic. So again, this is a really big issue that needs to be addressed. And again, that comes back to our clinics that we have at Aston and the research that we do as well.
yes. So that leads us nicely into my next question, which was about research and what happens at Aston Optometry, because you mentioned that all informs the teaching. So this is really important for the future of optometry and the future of these massively important regular eye tests.
That's right. Yeah, we have a long track record of research. I think, again, if we think sort of the history of the research groups at Aston. The what was the ophthalmic and physiological optics research group, which was established by Bernard Gilmartin in the 1980s, was one of the very first research units, if you like, at Aston, which was focused on a particular area when Sir Frederick Crawford was the Vice Chancellor at Aston. And since then, we have various names for the research group, but we've focused our research in particular areas. A lot on refractive error. So, as we've already mentioned, myopia is a really large area of our focus, but also on areas such as presbyopia. So, this is my research. This is where, as you age, when you reach your 40s and 50s, you either need longer arms or you need a pair of reading spectacles. Why does that happen? It's an inevitability, but what's going on in the eye? So we try to understand that more, and also work again with other healthcare practitioners, such as ophthalmologists, to work out ways in which we can either prevent it from happening or we can treat it better. So people's, again, later on in life, they have a better quality of life. So myopia, presbyopia, they're sort of refractive errors that sort of coexist. Do a lot of research there, and clearly that feeds in directly to what we do as optometrists. But we
Yes.
also have speciality interests elsewhere, such as dry eye. Again, this is a huge problem. People are using computer screens. We seem to be attached to them, either our desktops, laptops, or iPads and smartphones, etc. And dry eye is becoming a really significant problem, air-conditioned environments. And it's a
Yeah.
really complex condition, really, which can have a really negative impact on people's, again, quality of life. It sounds like quite a simple thing, really, dry eye. And you would think with some simple drops it could be treated, but that isn't always the case. So we're doing a lot of research on dry eye, and that's fed into global guidelines for how it should be treated, how it should be diagnosed, etc. And there's a whole range of other research that goes on as well on glaucoma and detecting conditions using instrumentation that we have. We have a lot of app developments which can
Okay.
support patients and also support the practitioners. So I could go on and on, but those are the sort of the key areas that we're interested in at the moment.
Brilliant. So there's lots going on. We've talked about undergraduates a bit. There's also a big postgraduate program, isn't there, at Aston University, which again directly related to the research.
Yeah, absolutely. And that's so important, coming back to Eye Health Week and supporting patients and making sure that they have access to the right care at the right time close to home. So we're very passionate about not only training new entrants into the profession, but also supporting existing clinicians on the register to upskill so that they can work to the top of their license and they're able to support their patients. So that could be on anything such as medical retina. It could be on glaucoma qualifications, higher qualifications. A lot of these are accredited by, again, the College of Optometrists that I work with as well, both as president and as now as chair of the board. Pediatrics, again, that fits in with the sort of the myopia element. And low vision. We do a lot of low vision work. Recently, the RNIB were on Aston campus. It was last week, and they were talking about the eye care support pathway, and that's how can we support patients right through the eye care journey, from that initial consultation, even through to when they have a sight-threatening condition that has taken either some or all of their sight. How can we support them at different stages as clinicians working as a multidisciplinary team? So all of that then feeds back into what we do for our higher qualifications at Aston.
Okay. Yeah, it's good. There's lots going on. So, if you could give people one piece of advice about keeping their eyes healthy, what would it be?
Oh gosh, that's so hard, isn't it? One piece of advice,
There could
like
be two.
any other. Yeah, there are going to be. I think the first thing is make sure, even if you think my eyes are fine, I don't need spectacles, I don't need contact lenses, and I have no, symptoms. You must always make sure you have regular eye examinations because, as I said right at the very beginning, even if you think there aren't any problems, there might be something lurking and it might be changing so slowly that you can't detect that. So, first and foremost, regular eye examinations. And I think then the second thing is a healthy lifestyle. It sort of goes without saying, smoking increases risk. And your diet as well. So, the back of the eye contains all of those blood vessels that I said we can see. So if you know, your blood pressure changes or you have lots of cholesterol, that in turn can have a negative impact on the back of your eye and therefore the vision that you see. And like brain tissue, once you damage some parts of your eye, at the moment at least, we can't rejuvenate and regenerate those tissues. So that damage stays fixed. So if you can prevent any of that happening by having a healthy lifestyle and then making sure you have regular eye examinations to catch anything early so it can be treated and dealt with, then that should, put you in a good position for good quality vision for the rest of your life.
Brilliant. Well, Professor Leon Davies, thank you very much for joining us on this episode of Aston Health Matters for National Eye Health Week.
Thanks, Helen. Take care.